Hello, my name is Trisha Parsons. I'm a physiotherapist and a recent recipient of an AMS Thematic grant. I'm also a faculty member at Queen's University in Kingston. And I really am excited to talk to you today about the project that we are working on. I want you to take for a moment and think about the last time when you genuinely felt seen, heard, and understood. Maybe that was a moment today where you were a bit stressed about work or something at home, and a good friend of yours listened to you over a cup of coffee. Or maybe it was a moment with a trusted counselor where you were needing some help to grieve for the loss of a loved one. Or maybe it was something as simple as you were struggling to carry a load of groceries into a building and some stranger volunteered to hold the door for you. Whatever that moment was, I want you to think and reflect for an instant on what it felt like to be seen, heard, and understood. Listening and understanding are acts of witnessing. And witnessing is the shared vocational call of all healthcare providers. We witness the experiences, the suffering, the joys of our patients. Now, that act of witnessing can have positive or negative effects, depending about how you go about doing it. On the positive side, to witness mindfully means that you are actually attentive in the moment, and that mindful witnessing carries with it benefits. It can help you grow your sense of self. It can help you to appreciate the connections between yourself and others, and ultimately, it might contribute to your resilience. Although witnessing is very important, it's interesting to note that many healthcare professionals don't have much opportunity to explore their role as a healthcare witness within their entry-level training. In 2013, with the support of AMS Healthcare and Queen's University School of Rehabilitation, I was able to become an AMS Phoenix Fellow. This fellowship gave me the opportunity to develop my own skills through workshops that I took at Columbia University Narrative Medicine program and the Center for Narrative Practice in Boston. And ultimately what I was able to do was to develop a narrative practice seminar, which was embedded in a core course within our physical therapy program at Queen's. Now this seminar creates a space for up to 75 students each year to explore their role as a healthcare witness. Basically that they're able to elicit, attend to, and be moved by the stories of their patients, of each other as colleagues, and ultimately of themselves. Recently, just in this past year, myself and two colleagues from Queen's, Dr. Kathleen Norman and Dr. Deborah Trigano, herself an AMS Phoenix Fellow, were fortunate enough to receive an AMS Phoenix Thematic grant, which is enabling us to do a rigorous program evaluation of this seminar. We are really interested in developing a sustainable educational experience for our students to develop these healthcare witnessing skills. Further than that, we're hoping also to see how this work might roll out and expand into practice environments. And to that end, we're partnering with three groups. One is the Ontario Internationally Educated Physical Therapy Bridging Program at the University of Toronto. The second is the Southeastern Ontario Regional Stroke Network. And third, the Ontario Physiotherapy Association. Our hope is that this work will continue to help us build the capacity for these narrative listening and witnessing skills within our region. Nelson Mandela once said that society needs to reestablish a culture of caring. The stakes for completing that work have never been higher. Recent political events in the United States, and here even with our own experiences in Canada with the Truth and Reconciliation Commission, really underscore the need to develop compassionate communities of listeners, people who are willing to listen and understand each other's stories. With the help of AMS Healthcare, my colleagues and I are working to create those spaces and experiences within our region. Thank you.